Now that you've looked at the video and listened to the podcast on compressions or pressures, we're now going to look at frictions, which is slightly different. It's a very in-depth technique and can be quite aggressive and quite painful for your clients. You need to use this one with care. It's designed to release localized areas of tightness where the muscles have become stuck, and the principle is realigning or breaking down the area. So it sounds aggressive, and it is aggressive. So like I said, play gently with this one.
Absolutely. It's really important also to only use this technique once the muscles are well warmed up. If you start with this technique, you could do quite a lot of damage to the soft tissues. And also it won't do a lot of good because there won't be any blood flow, there won't be any warmth, and someone's going to become sort of quite resistant to the technique. So at this point, you'll start to feel areas of unevenness, tightness, or even scar tissue. And that can be something that you can start to look at breaking down using these sort of techniques. Areas that often respond well to frictions, they feel a little bit fibrous in nature. That's the sort of what you're looking for under the skin, is something that feels a little bit uneven and quite tough.
You'll know them when you find them, I think. They kind of stand out, don't they? So with this, it's really important to start with your 10-second press test and make sure you're choosing the right technique. So that's really important. So exactly the same as compressions, you go in, hold it at about a level of 4 to 5.
Yeah.
See if the pain decreases for your client or increases or stays the same. So can you remember? If it increases, you don't do anything. If it decreases, you can then do your compressions. And if it stays the same, you're up for a friction.
So once you've done that test, maintaining the contact on the point so you don't lose what you've just sort of decided you're going to work with. First thing to do is get your client to breathe in and breathe out. As they breathe out, again, apply the pressure gradually to around a sort of 5 to 7 perhaps. That's sort of out of 10. And then again, make sure your client is comfortable and okay. You must know your anatomy for this technique, because once you've applied the pressure, you're going to vibrate that pressure backwards and forwards over the same spot in line with the muscle fibers. So in the video, you can see, we'll show you a couple of different examples, couple of different areas, and those are really, really important to sort of make sure you know where you're going so you can stay in line with the fibers. Once you complete, this technique should be used for no longer than 10 seconds at a time, and exactly the same as compressions. Once you're done, flush through the area to help remove any waste products, and up to 3 times in one area is absolute maximum for this one.
Yeah, I would say absolute maximum. If you can avoid doing it more than once, I would, because it will get uncomfortable. The other thing to remember here from a practitioner's point of view is protecting your joints.
Absolutely.
So always double finger, or double thumb, should I say, or double finger even. You can put finger on top of finger, but you can see some examples in the video of what to do.
So how does the technique work? In essence, what you're trying to achieve is a feeling of rubbing out the area of the tightness underneath. That's how I try and think about it. What's actually happening is you're encouraging those fibres back to the correct alignment. Anyone tells you that they're breaking stuff down physically and breaking the substance down underneath, they're probably working too much, but you are encouraging those fibres back into their correct alignment, especially useful in people who've suffered an injury. So as the technique's invasive, it's really important to acknowledge that the client might feel sore afterwards. Keep them relaxed during the technique, and also warn them about this, that there might be sore afterwards and there could be a little bit of bruising.
So what Charlotte's just said is actually really important, and it's really important that you get informed consent before you even consider using this, and really discuss it through with your client, because it is so aggressive. But the useful thing about this technique is it's very versatile, because it's such a small technique. You can use it in lots of areas and lots of tight areas as well. So that's everything for friction. So go and watch the video. Obviously, there's a bit more commentary there for you. But again, this is one you need to practice regularly. You need to practice all your techniques, whatever we say. So give it a good practice. Decide where it's versatile and work from there. Enjoy your video.